Good morning, Fertile Fireside Chat. How's everyone doing? Welcome, Vanessa, Mara, hello. My battery's a little bit low. Hopefully it's gonna stay rocking and rolling. I always have a little bit of a backup if need be. Gratitude to everyone and welcome Sunday. Oh boy, where are we? Oh, September 13th. The universe is moving. The cold weather is beginning to blend in for all of us, and I hope everyone's having an awesome and amazing day. No matter the troubles, the challenges, the fear, the worry, the regrets, all of us, we are alive. Hello, Education Lizzie, Making Baby Sprout. Hello, Alice, Melissa, Christina. Hello, Sherry Shore. Hello to everyone. Welcome. Sunday morning, starting the day, and a little Fertile Fireside Chat, answer questions. Just keep us all living and learning every day, no matter what's going on in your life. And there's a lot of challenges. Don't let that go, and don't believe that you're the only one with them. We all have them. And how can we use the fire of life within the mind? And remember, what you put in the mind and the mouth matters most for that fertility and better every day, right? All right. Sonal, hello. God bless you. Nicole, Tara, Caitlin, Lucy, Chelsea, good morning. Andrea Lynn, Young, Hagen, a pleasure. We're learning, we're integrating, we're getting our Colorado, our Atlanta, our Montreal, and everyone's sort of integrating. Buffalo, starting frozen transfers, I think, next week. Dr. Chang and myself, Dr. D'Souza's going to be getting rocking and rolling. And Sammy work 7 years. CNY did it. And we're working for CNY to do it for all affordability, quality, access, and integrating Eastern and Western. And remember, never, ever, ever, ever give up on this journey, no matter what the universe is throwing at you. And it throws a lot at us. Some days it's like, whoa, where'd that energy come from? Michelle, Kelsey, good morning. Marie, Stack, hello. Ray Lee, Altamis, always a pleasure. And really for everyone, new and old, learning in the sense of we've known people for a long time or newcomers here. CNY Fertility is really working to integrate affordability, quality, access around the globe. Bringing in immunology, reproductive immunology is something we really, really focus on. We talk about faith and food and integration of acupuncture, massage, meditation, and prayer. And if what you're doing isn't working and failure, always look and say, okay, what can I do differently? Do I do a natural cycle? Do I do a mini dose protocol? Do I add some of the immune protocols, 1, 2, 3, and 4, where we go from simply a little bit of steroids, antibiotics, and aspirin, all the way to IVIG, Humira, LIT therapy, and I think Nogales, Mexico, you can go get your LIT therapy. We do things like intrauterine and intraovarian PRP, a stem cell treatment to work to try to bring together some ideas that are out there in other realms of medicine, and especially on the reproductive immunology side. There's a lot for us to learn. How long after methotrexate for ectopic pregnancy can you do an FET? I say 30 days after that last shot, you could put an embryo in there. By the time you get your shot and you get everything going again, it's more like 6 to 8 weeks in most cases anyway. So Natasha, the overseas stuff is a little bit more challenging. You can connect through me on Facebook. I'm really working to look at that a little bit more. People text me on my cell, 315-416-9872. I really work to integrate those and get a chance to converse with people. Please recognize we get a lot of text, emails, and calls. We're doing our darndest and our best every day to provide you with the very best care. And so let's not give up because it's hard. And that's the challenge with all of this. It's all hard and difficult. How do we not give up in all of this? Split in two, a uterus, bunny ears, DFE, Tay Johnny. Yes. So if you have a didelphys, or a bicornate uterus. So you have two separate, or a unicornate or a bicornate. Pregnancies can happen. Some of those may just be a septum and you just don't know it, because sometimes they're misdiagnosed as one thing, but there's something different. So don't give up on, hey, maybe I need a better ultrasound, a 3D ultrasound, an MRI, or a diagnostic laparoscopy, hysteroscopy to really formalize the diagnosis. Love to all mamas to be. And we're working every day. Your feedback on what we are doing, saying, and how we're doing it, we always need better. And we really, again, critiquing, and the creativeness needs critiquing. And none of us are ever out there, in my opinion, or all of us needs to be the work recognizing that we need to be respectful to everyone every single day. And sometimes I even say something, oh my God, did I say that? Please, all of us, we need to listen and learn and love and say, hey, wait a minute, what can we do better? We are here to do that. The CNY Fertility team, the global team, the local teams, the embryology, the surgical side, all of us on every level really working at. I'm working on Atlanta doing transfers in the spring, and then hopefully doing retrievals later in 2021. So we're really working on integrating. We're working to train more of all of us to help us with monitoring. Get your OBGYNs, local radiology, blood testing. We're really working to make it easier and more accessible and affordable for everyone in this journey. Kelly, hello, from East Ohio, Northeast Ohio. Hello to you. And on Estrace, Maza 84, Estrace for 2 months, doing PRP and hysteroscopy. I'm scheduled to get period this week, so I can start stim. Should I start prometrium this week leading to a period? That's not a bad idea to do the prometrium for a week. I sometimes do it longer and then stop both the estrogen and prometrium, get a menstrual cycle, although it's not always necessary in order to do a fresh transfer. Sometimes you're leading it with a thin lining, and sometimes that thin lining is 7 millimeters, and recognizing that lining is going to get to maybe 15 to 18 millimeters, which is okay. Dreamed of twins and got them. We were with CNY 0513 to do not think you can't get pregnant. You can. No matter I am obese and lost 10% body weight, and it worked. It's not the loss of the body weight. When you're losing weight, you're generally reducing inflammation. That's really the ticket. Size doesn't matter. It's what's flowing in the belly. The bucket of the belly has a tremendous amount of fermentation due to a high plant-based diet. Complex carbohydrates take days and days and days to digest, and that digestion is creating an inflammatory environment that is not good at all. Sammy, hello. I was hoping to start this month, but I haven't received a call back. Started my menstrual cycle. Hopefully someone calls. So don't give up. Send in a portal message. We're really doing good at that. We're looking to grow our team members so we can continue to provide affordability. And the more we integrate that, the better. Envy My is, hello, how are you, Kelly? OB/GYN is not flexible at all, so I decided to come back to Buffalo. Yes, I know it's a 3-hour drive, but we can help you work with radiology, ultrasound technicians locally, LabCorp request to get your blood drawn. There's a lot of things we can do to keep you local, by the way. Laparoscopy, hysteroscopy, myomectomy to remove fibroids on the 24th this month. Let's see, I have prolectinoma. Husband has low morphology, both doing Kiltz's keto, supplements, already are both very healthy otherwise. Any other advice? So I feel hopeless, but hope is a never-ending, vast energy for all of us. Have only positive energy. So we all hold hope and never let it go. That's really the trick to this, all right? And yes, it seems hard. If you have a prolactinoma, if you haven't had an MRI to check macro or micro, are you on Dostinex or Parladel? It can be helpful, and Kiltz's keto is a home run. Personally, I'm carnivore, but Kiltz's keto is a high-fat, low-carb, low-protein diet. Remember, but it's not a diet, it's a lifestyle plan to feed the most amazing Ferrari in the universe. You guys, Ferraris, temples, expensive, irreplaceable, and most valuable. Begin to take care of yourself like the most amazing thing ever in the universe. Never, ever, 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 ever lose hope, because hope is the universe. It's everywhere. It's everything. So when our brain begins to lose something, we just need to open our eyes and see that it's all around us, and all of us together in our energy of kindness, love, vibration, gratitude, and graciousness, even in the most challenging environment of the universe. And God is the power of everything, and it is all the energy of the universe. So it can never be lost because it's everywhere. That's the trick to this. So don't lose it, all right? So Kiltz's keto, faith, faith, faith. That's the powerful thing. Remember the vision board. Put the vision of what you desire as if it already is, and it will be that or better. Never lose that, right? Or if you think you've lost it, pick up a book. I pick up, if you haven't read A Course in Miracles, it's just a little tiny book, kind of like really small writing, but just open a page. It has something really amazing in that moment. Or you open the Bible or some biblical text of philosophy, of positivity. That's where I think it really comes. But think about, remember, if you haven't had a laparoscopy, hysteroscopy for endometriosis, we talk a lot about the antibiotic, antifungal, antiviral protocol. I call it the anti-3. We are all basically a culture dish, which a tremendous amount of bacteria, yeast, and viruses. We know this coronavirus, the COVID, is everywhere. And basically we exist because of these proteinaceous particles that are basically, like sliding in a little bit of their knowledge within all entities. And we are growing because of that. So sometimes we have to wonder whether or not there's some value to this craziness that goes on in the world. And I always say God knows best. And when we basically think about the universe is always working to do better for each and every one of us. All right, RPL, I have the faith, and keep it there. LDC Dog 2, Shine Key Shine. And we all hold the master key to the universe because it's within our minds. The mind is the master, and if you haven't read James Allen, you have a treat in store for you. It's within all of us. Remember, just because we're fertility doctors or we're scientists or whatever we do in life, we all have the vibration and energy of God within us. Don't lose that fact. With that, be open to all the possibilities. I am having a baby. Babies are abundant and vibrant and flowing in my life, whether it's adoption of a baby, an embryo, donor eggs, donor sperm, or you're using a gestational carrier. Be open to the possibility, but don't lose the fact that you already are perfect right now. There's no seeking of something. You already have that thing you are seeking. Very complicated. 3 consultation with you on October 3rd. Is there an email address that can send my records? You may send them to me, and if they're like this thick, things are actually simpler than you think, by the way. Be glad to take a look at them. When you call, I will review them with you. You can imagine my time, but I have the questions to ask you in order so I'm not distracted by too much data. I call a bunch of distracted data doo-doo. And when we really want to recognize that it's all simpler than you imagine. Egg, sperm, embryo, the vessels, and how we care for the vessels, and whether it's endo, scar tissue, fibroids, polyps, adeno, whether it's unspecified, unknown, whether I got bad DNA, DNA fragmentation, by the way. And interesting enough, when you do an IVF cycle and retrieve eggs, that's when we finally get a chance to look at your eggs and see how they work, like looking at DNA fragmentation on the sperm semen analysis. We then get a look at what are the eggs like, because otherwise there's no other test to give us that information of what's going on in there. Kiltz at CNYFertility.com. But remember, I'm on the phone talking or working 24/7, 365. Everyone has to be patient with me in my ability to get to you. If it's a 911 emergency, call 911, go to the emergency room. I am here with my cell phone, my email, and my ability to get text. But if it's an emergency, I can't take care of it that way. And I apologize. All of us are doing our very best to provide the information globally. Look at our family building guide. Look at our keto lifestyle. Look at my intention books. Look at the Fertile Secret book. How we are all integrating an ability to bring the secret within all of us, right? It's already there technically. You just have to recognize it. So books. So Think and Grow Rich, The Power of Positive Thinking. Oh, The Alchemist, one of my favorite books in the universe. And remember, dead people have no problems. Live people have the presence of problems. In the present moment, the problem is actually the gift. This is the power of the universe. It's within all entities of the universe. So don't give up. Let's see. Genetic testing does have Noonan syndrome. Every human being has the right to be alive no matter the syndrome. You decide if you want to do genetic testing, if you want to see whether or not this syndrome has a genetic link and you want to try to reduce the incidence of that, then genetic testing and genetic counseling. We use Cooper Genomics as our primary source of genetic screening and testing and all of this, all right? Expected on a phone consult, Michaela Shaw, hi. Hello, how are you doing? I'm Dr. Robert Kiltz, here to share some ideas. What's your age? How long you've been trying? Have you had any pregnancies, any babies? Do your cycles regular or irregular? Any medical conditions? That's the simplicity of it all. Are your tubes open? Do you have sperm? All right. Now, if you're in a same-sex couple, you either need sperm or you need eggs or you need a uterus or you need both. These are simple questions that are really answered very quickly. I often will ask kind of like, do you exercise a lot? What do you like to put in the mouth? Oh, I eat healthy. Now, when everyone says that to me, I say, well, wait a moment. Maybe not. Maybe what we say about food is not as healthy as you think. Because typically we say, gee, my disease is unknown cause. Well, maybe not. Maybe there's something more to be said. And when you look at my the Family Building Guide and Kiltz's Keto Lifestyle book, and then you look at our Simple Guide to Improving Your Fertility, it's just like a 8-page handout that we also have out there on the website. Look at the patient portal and resources, and you'll find that there also. But I spend about 30 minutes asking questions, giving my thoughts and ideas. If you continue to read, listen, go to our website, go to our drkiltz.com, look at our YouTube channel. And really, this goes so fast in this hour of the Fertile Fireside Chat. I'm not getting a chance, obviously, to cover everything. It's my speed, because I'm a little bit of a speed demon in all of this. All right, Tara M. What are the chances of first cycle success? Factor 5, severe MFI. All right. Chances either 0 or 100. Where do you want to put yourself? Always imagine the 100% rule, right? If you hold that in, it will be unfold in amazing ways, right? Always imagine 100% for me. As you're moving forward in anything, oh, this will never work. This is too hard. My chances are so small. Well, how easy is it to change the mindset, change what you believe and think? It's all good. And that's really what this is about. So the factor 5, anytime you have inflammation, it's all going to affect the blood system, the clotting system, the vascular system, the electromolecular system, right? Remember, it's a flow of fibers, of neurons, of blood vessels, of lymphatics, of connections to the brain and all entities of the body, and everything and anything we can do to reduce inflammation, increase blood flow, allow the electromolecular system to work the way it's meant to work in a perfect environment. My daughter and I talked a little bit about clearing the weeds to make way for the seeds. The weeds are the worry, the fear, and all the yickety-yak we put in our mind and our body every day. This is why Kiltz's keto is 1 meal a day. OMAD, 1 meal a day. Now, I do at night, rest and digest, bacon, eggs, butter, beef, ice cream, plus salt. Remember, sodium chloride is what our body is made of, plus fat and water. It has a little bit of sugar flowing around as glucose, but your body wants your sugar to be 60, not 80 to 100. That's why the fasting, I call it intermittent feasting, 1 meal a day, which is really the best way to fuel the Ferrari, which we are. It really, really, really helps in so many ways. By the way, we're working on our ability to communicate and give support. We're adding a little bit of an extra line through Fertile Hope Yoga. I'm working with Danielle and Lisa and others to bring that, Dr. V, Jennifer Waters, Don Clark, and really the support system that you guys on a voluntary basis really help communicate and help everyone in this crazy, crazy journey. And remember, every day, thank you, God, for this day, Lord, Creator, nature, whatever your belief in the higher power is, I am grateful for the day. My meditation is always gratitude meditation. Thank you, God, for this day, for this energy, for this life. I appreciate all that is in my life every day. If you're thinking, why this happened, this is unfair, unfortunate, not right, well, that's the negative energy, and the universe is going to give you cortisol and epinephrine. That's going to reduce your blood flow to the reproductive organs. You want to be in a vibrant, joyful energy of life, which will bring lower cortisol and epinephrine, oxytocin and serotonin, opens up the blood flow, allows the electromolecular flow within your body, your mind, your energy, your everything. All right, Molecular Fertility, our new supplements. Go to our shop segment on our website, CNY Fertility. Molecular Fertility female and male supplement. And then the Ovarian Bloom. We also have some DHEA. And we're also adding our hemp oil, which is CBD oil, which I really believe that a little bit of the hemp seed oil reduces inflammation. CBD is anti-inflammatory. Low dose naltrexone, LDN, for guys and gals. And remember, when I talk about keto, Kiltz's keto, it's for the male Ferrari and the female Ferrari, the lioness and the lion, the temples. We must believe and see our bodies as the most amazing temple every single day. Remember, no matter the challenge, the heartache, the worry, the fear, the regret, the judgment that we kind of feel the universe, but when we open up with love, bingo, that's really the best in all of this. Had my tubes removed, is it possible to have a baby? If so, IVF is the only option if you've removed your fallopian tube. So we collect eggs after stimulating the ovaries for about 10 days, and then retrieve eggs under conscious sedation, and then we add the sperm to the eggs via ICSI, and then we transfer embryos 3 to 6 days later as a cleavage stage or a blast. We are now offering and integrating the embryo glue for all transfers. We're going to be going up to $39.95 and I think $6.95 for transfers, a little bit of an add-on cost so we can spread it out and make it still affordable quality and access. So we do assisted hatching routinely, and again, in general, 1 embryo, 2 at the most, 99% of the time, but we do it individually in defining who gets that. West Coast, we're working on the West Coast. Let's just keep CNY Fertility West, CNY Fertility East and Central, all North and South. But know this, we can only take care of so many people in the day, 24 hours to a day. And I always try to add hours to my day, but I'm doing the very best I can. I'm gonna, at some point, I've got to just shut it down so I can get my rest. And so sometimes I get these text messages coming through and I just can only do so much. I apologize. If it's a 911, call 911. Do not give up. We need to make sure everyone has all their medications, all their understanding of their financials and everything before they get started. Can you go right to donor eggs without even trying your own? Yes, One Wish 421. We can take you right to donor eggs, donor sperm, donor embryo, gestational carrier. Remember, we are helping on the natural side and the integrative side also. So it's all together, right? All right, Melissa, hello, and Tanya, hello. Jessica, where should progesterone be during a transfer? Typically, we look at 20 for the progesterone, but there's a range of 10 to greater than 40. So we check these numbers and we manipulate them within a few days. It's not like, oh my God, let's get your call. It takes sometimes a day or two. A lot of times your progesterone seems lower, but the local environment due to the vaginal progesterone works really nicely. All right, you guys enjoying the Fertile Fireside Chat with Dr. Rob Kiltz, CNY Fertility, answer your questions, integrating Eastern and Western medicine, and learning every day of new ways. And I've learned about low-dose naltrexone or acupuncture or keto diet, the keto lifestyle plan, let's call it, right? How do you feed a lion and how do you feed a pig and a cow? Remember, we are what we eat and we are what we think. The more we can integrate a positive thought project to our mind, the more amazing opens up. Henny, hello. Amber Webb, IVF, let's see, yes, thank you. Sherry Godot, hello. Lee, Jacqueline, Allison, and Lena. A shout out to my embryology teams at all locations, Syracuse, Albany, Buffalo, Colorado Springs. We are really working to train our team members to grow more embryology, andrology. We're training our practitioners to continue to learn how to be better in the monitoring, also learning and growing with making transfers more accessible. So as I said, embryo transfers in Buffalo are coming in a week or two. Retrievals are likely going to be in October. So we're really excited about all that. The tacrolimus or the Prograph, you know, I've often been going to 8 to 10 weeks rather than stop it right away. Often we switch to Plaquenil. Remember, when you're pregnant, Kiltz's keto is critical. Kiltz's keto is critical for life. This is the thing that I've learned. It didn't make sense to me until I did it. Bowel bleeding gone, migraines, arthritis, psoriasis. I'm still neurotic, but somehow I'm using it in my favor. Attention deficit hyperactivity. It really helps. Molecular fertility. Take a look at our molecular fertility page, the CNY Fertility, molecular fertility supplements, and we're really here to share and help everyone. Will keto help reduce A1C? Cruise, absolutely. Look at carbohydrates are deadly in my opinion. A plant-based diet is not the way to go. But if you're going to eat a plant-based diet, eat one time a day and add the fat. Coconut oil if you're a vegan, and cream and butter. Now remember, I use it, add more. It reduces inflammation. That's why we give intralipids. This is why we do things like Lovenox, Plaquenil, Prograph, Neupogen, and all of our immune protocols, because it really helps. Phone consult, Chastity. Before a phone consult with any of our providers is listen to Fireside Chat. Go to our books, the Family Building Guide. Look at Dr. Kiltz's Keto Lifestyle. Look at our The Fertile Secret. Look at our Daily Intentions. Talk and listen and learn of our methodology, which integrates Eastern Western philosophies, recognizes that data often is doo-doo, and remember, data is looking at averages, but you're not an average, you're a unique star in the sky, and our job is to understand your individual data as best we can in order to give you the very best options. If you have a lower probability and recognize that sometimes it might seem like a no probability, we are open to doing something that others might say no way. We do not have a BMI restriction. We're here to help you. You don't have to lose weight ever, in my opinion, because weight loss is not the way. It's keto lifestyle. Kiltz's keto lifestyle is the key to amazing things. And as I've learned it, as I've done it, as I do it every day, I'm like, wow, I can't believe this has changed everything going on within me. Keto since June. And Kiltz's keto, it's the home run to me. But if you're a vegan vegetarian, remember, you can do it. We share that energy and vibration. I personally am mostly carnivore, but I was at Mirabeau last night. I had great oysters. I had the strip steak with some blue cheese. It was Pittsburgh. And then I had some French fries, beautiful, dipped in mayonnaise, amazing. And the team there, TJ, Michelle, Heather, great, met some really great friends there, and connecting and listening and learning through all of our experiences of life, by the way. My HSG, SHG schedule for next week. Does a doctor perform these? Rand, WSA, say IVF. So in New York, the physician will perform the hysterosalpingogram. The saline histogram, if it's done separately, one of our practitioners or nurses can perform that. And really, they're quite experienced at it. I mean, there's nurse practitioners and PAs doing cardiovascular surgery, orthopedics. They're the primary care provider in hospitals. We recognize that if we all can train, get the proper training, we can do even more. I've been doing Kiltz's keto, mostly meat. That's what I do. But remember, more meat isn't going to make you healthy. It's fueling the Ferrari properly, one meal a day at night, and visualize and spiritualize the power of what is and can be in this universe, right? And if you have the belief and faith in that which you desire as if it is already here, it will unfold even more and more amazing ways. Going into IVF in November, I have a couple of questions. Do you perform embryogenetic testing? We do, if that's what you would like. Embryogenetic testing is not accurate. If you want to throw away an embryo in kindergarten before it's given a chance to at least get to the first grade, and you'll read more and more that it's not perfect. Now, if you have a lot of embryos, it still may be worth RN to do. But I'm not here saying, boy, this is the greatest thing in the world. The way to get pregnant is have sex. If you can't have sex as a means of getting pregnant, then IUI or IVF or donor eggs, donor sperm, donor embryos, and gestational carrier, with or without the genetic embryo testing, but it isn't as perfect as you believe, or it's only as perfect as you believe, and that may hold you back or be blinded in the possibilities of the next level. All right. Ruby, Tuesday sometimes had buy one, get two. Oh, a really great Pittsburgh style ribeye steak with the fat on it and the butter. Oh, it's a rock solid, and put some really great sea salt on it. All rocking. I was at the York the other day in Armory Square, and the other great place to get a steak in Syracuse, if you're visiting Syracuse, is the Lemongrass. So just say, hey, I want Kiltz's steak. And they'll bring it. And if you don't like it mooing, okay, ask them to just a little bit more. Terry KF, Florida is coming. I'm working on it every day to have the faith and belief in the direction that we're going. Michelle, hello. Oh boy. Pauline, hello. LEAP surgery in the past. Let's see. So LEAP is cutting off a part of the cervix where you may need a cerclage. This is where IUI or IVF come in. I think if you're not getting pregnant unnatural, it's natural sex, IUI, and there's even ways to do intravaginal, intracervical home inseminations, and we're working on that kit for those that want to try it, do it. 44 MH.9, only praying for a healthy embryo. So you have to imagine your embryo is healthy, not say, gee, please give me one. Thank you for my healthy embryo, my healthy baby. Always dream about the outcome, not the steps on the way, because God's got the steps to get to the outcome. That's where faith comes in every day. Thank you, Lord Creator, for this awesome and amazing day. Yes, if Florida happens when? I'm working on it for 2021 to 2022. First, brick and mortar, then frozen embryo transfers, and then fresh. And so it's coming. Alternative to Neupogen, Patrice. Neupogen, GCSF, granulocyte colony stimulating factor, intrauterine or sub-Q. Now, before a transfer, even could be used prior to intercourse IUI cycles that may be helpful in all of this. By the way, thank you very much for joining me. As you do. I'm here pretty much Sundays now because we're so busy during the week. Just to get to you guys is a little bit of a challenge, and I want to bring my very best to you guys every day. Hey, Donna and the travel team, the global team is amazing. Thank you, thank you, thank you. The whole global team and the integration of what everyone is putting together. I'm so proud of everyone. And yes, it's hard work. You know, some days I get yelled at and we all get yelled at, but we recognize it's the stress and struggle of the process. And we're here to open up and listen and learn to do better. We're working hard to get to those calls. You know, I get text messages, I forward them along. I do the best I can. At some point, I just got to put my phone away and get my beauty, rest, sleep, and I even take power naps during the day, which is really, 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 really valuable for everyone. Intralipids. Intralipids, okay, so we have to recognize, and my team has to recognize, intralipids, Lovenox, PRP is for everyone. Whether your AMH is high or low or normal, it doesn't matter. We have an integrative recipe for everyone. Intralipids is fat. Fat reduces inflammation. That's why keto lifestyle, Kiltz's keto lifestyle, is so critically amazing in all of this. And so it's so valuable. Be open to the possibilities in this, okay? And so basically what we're looking to do is share ideas of something opposite. A healthy plant-based diet, 3 to 6 meals a day. Well, if you keep doing that and it's not working, why do we keep doing that? Why do we keep doing that which they tell us to do and not begin to think outside the box and or create your own box? That's what this is. That's it. Hashimoto's, prednisone, yes. So steroids, whether it's Medrol, dexamethasone, or prednisone. Prednisone is our primary. Much of what we're doing is focusing on reducing inflammation. Hashimoto's, thyroiditis, pancreatitis, colitis, Crohn's, liver dysfunction, gallbladder, appendicitis, arthritis, psoriasis, ALS, MS, chronic fatigue syndrome. It's all related to inflammation caused by the five things as Kiltz has listed. Kiltz is 5, right? It's glucose glycation. It's mostly plant and other microorganisms, antigens, chemicals, phytochemicals primarily. Then the fermentation via yeast and viruses and bacteria in the GI tract, mostly the colon, which produces heat, alcohol, aldehydes, and methane. And then, come on guys, get off the treadmill and slow it down. The more miles on a car, a bike, or your body, the less it's going to function. It creates heat and inflammation. It's not good for your eggs, your sperm, your embryos, your uterus. That's the deadly cause for all of us. My opinion, those 5 are the cause of cancer, heart disease, and everything we suffer from. And it makes us more susceptible to the viruses, the bacteria, and the yeast because we're providing the environment of a high sugar glycation environment. It's not good. I know. It sounds crazy, right? It did to me as a fertility physician that I said, no, wait a minute, that doesn't make any sense. But I ate a high plant-based diet for years, low fat as a Mediterranean Italian, lived in LA, a lot of Mexican food, a lot of Thai, a lot of Chinese, a little of everything. I'm mostly Italian. But I had the bowel bleeding and the migraine since a kid and until my early 50s when I finally learned about keto and paleo and inflammation and really focused on the truth be said, the cause of disease is not obesity. It's what got you obese, which is the carbohydrate diet, and it's not the chips and the dips and the fried food. I'm sorry, it's the lettuce, the fruit, the fiber, the vegetables, the healthy stuff, which may be the deadly stuff. Hello, Jennifer and Stacy and Claudia, pleasure, and Sierra. Hello, and the support groups that you guys are forming, I'm really grateful. We're all working together. I can only do so much. I share my ideas, my thoughts, I write them down, I share them to you guys. You guys, you know, it's the viralness of what we share, but maybe we got to change that because kind of viruses we're scared of, right? We want to share the energy in a holistic and a fertile way. The energy of love and gratitude and kindness. Really, we want to unfold that to reduce the inflammation, increase the blood flow and all that. Emily, the retained embryo during an FET decreased the chance of implantation. So if you had a retained embryo in your catheter, it's a stickiness. That's a good sign. Put it back in there. I think it has an improved chance, by the way. I've been stimming with letrozole for 6 months. Should I let my ovaries rest before switching to IVF? Low AMH. 30 days. There's 30 to 60 days of human growth hormone, amitrope or Serovital, along with esterase, 2 milligrams, prometrium, 200, with Kiltz's keto, LDN, CBD, again, acupuncture, massage, all these things integrated. And remember, faith is the fertile Ferrari. And remember, you and I are the Ferraris. We're not the Yugos. We're not the amusement parks. We're not the pigs and the cows, although no disrespect to any of that. We are the fertile Ferraris. We are the temples. When you begin to treat yourself, mind and body that way, more unfolds in a more amazing ways. Yes, that's $50 for a phone consultation. If you have no insurance, we bill your insurance if you have it. Ultimately, if they don't pay, it's $50. And it's, it's an investment to your future. That's what this is all about. You have to ante in life in order to get the things that you desire. The universe is full of infinite amount of energy, whether it's in the form of your beliefs, of money, it's flowing everywhere. And all you need to do is recognize that faith trumps everything. Aventura, which clinic do you recommend for monitoring? We'll work with any of the clinics. They're awesome and amazing, and recognizing that, if you fail with us, you might stick to them. And I always say, hey, listen, can I get monitoring with you? I'm going to go to New York to get a retrieval and transfer. And can you do this? If it's a no, because you got to ask, you go someplace else, and we'll work with you to help with this. But really great, amazing fertility doctors in this globe, all working together. In my belief, the more we can work together, the more that we can help you make affordability, access, really the entity and the plan of the universe. DNC and laparoscopy before IVF, 5 failed IUIs. I think DNC, hysteroscopy, laparoscopy really finds and looks for chronic and acute inflammation, whether it's localized as powder burns in endometriosis, or it's more global erythema or typical lesions. I believe that laparoscopy, hysteroscopy, flushing the tube, doing a gentle curettage, dilation and curettage, DNC. I know it seems barbaric, but just gentle. A gentle clean out. It's like a debridement. And then the antibiotics, antifungal, antiviral. We do a lot of Levaquin, Keflex, Diflucan, Valtrex in all of this, and maybe Flagyl also. A global approach, just like you treat things like Lyme disease. It's antibiotics for a few months. I found that there's really value to these, but I think a laparoscopy, hysteroscopy, I recommend so many to do this. I found my local clinic from CNY website. Under travel, there's places close to everyone. We're really working to work with your OBGYN so that if you have a complication like ovarian hyperstimulation or an ectopic or something that needs your local care, we want to be able to work with them. Remember, this fertility journey of shots and pills and surgeries and retrievals isn't without some risk and complication. So don't walk into this thinking, boy, this is perfect and nothing bad's going to happen. Well, we're here to help you. Just like driving your car to the market, you could get hit and slammed, and it's a short one. One of our clients passed last week due to a car accident. We are so saddened by this, but each of us is on the journey that we're working hard to be there and do the work that God has created within all of us. Do not ever let go. Have love and faith and kindness within your mind and your body, and vibrate that. Ask, can you do this? Please, thank you very much. If you can't, thank you, that's okay. I'm just gonna go check over here. And remember, if you never ask, it's an automatic no. If you ask, guess what? 50-50 at least. Let's say it's 90% gonna be a yes in this, right? Be sure to check it. Found one about 15 minutes. Yes. And again, Through the winter, we are up and running. Syracuse knows how to land airplanes, and the roads are 99% still open. We are open. We're working on Atlanta for later next year and Florida for later next year. And our Colorado team with Dr. Magarelli is really rocking. We're really excited about that. We did a sperm aspiration, got no sperm on someone who had a vasectomy and a failed reversal. And it's very, very unusual to get no sperm in those cases. We then recommended Clomid and HCG combined for at least 3 to 6 months. Kiltz's keto, LDN and CBD, and remember, slow it down and cool it down. The Snowball underwear, I'm mentioning it. Look up Snowball underwear, which is a it's brief shorts with an ice pack to cool the testicles. And we need to cool the testicles and cool the body, not heat it up. That's critical. And I think there could be some really great stuff with that. I got one embryo, make it to day 5. Should I try Omnitrope next retrieval? Yes. Omnitrope, CBD, Kiltz's keto, LDN, maybe some DHEA, a month of either Serovital or human growth hormone to the process. And remember, Kiltz's keto lifestyle. If you read the book on Amazon, it's a Kindle, $4. It's a good investment, right? It really is what you put in the mind and the mouth makes this body the fertile body of the universe. And we can listen to people's frustrations and anger and fears and worries, and we can allow it to come within us and shine the body. Okay, I may be losing energy on one of my devices. If I do, if it closes down, I'll open up on my other. We're not giving up here, right? So it really is this ability to never, ever, 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 ever give up. Hold love and kindness and faith in the way, love and kindness and faith in the day. And I know we look in the mirror and quite often we ridicule ourselves, but no matter your size, shape, age, color, whatever the shapes of these things are, give love to the thing in the mirror first. Love is the critical thing that we all must shine, even in the face of fear, frustration, worry, and unkindness. But open up the unkind and you'll see the kind that is you and I, the same. With love and kindness, we vibrate and open up in this universe. I know it doesn't make sense, but God is the most powerful thing. Seen by high risk OB before doing IVF in November. I don't think that is necessary, but it's never a bad idea to talk to your OBGYN, ask them, do they take care of a 42 young woman who's going to be pregnant? Remember, your eggs are rocking, donor, your eggs, partner sperm, donor egg, donor sperm, donor embryo, someone else's uterus. And remember, we do gestational carriers. We do donor eggs, donor sperm, donor embryos. None of it is perfect. None of it is without risk. Remember that. Relationships are risky. That's called life. I'm nervous. I was put on too low of a protocol because I have a P2P2DAMH 7 4 LH, HCGLH 100, Follistim 225, Ganirelix, gonadotropin. Look at too low. I don't know what that is. Doing something. Typically, I don't look at AMH that much. I usually recommend a Follistim, 200, Follistim Menahir 200 to 200 to 400 is a reasonable dose. Lupron trigger and a little bit of LH, HCG in the 200 range. So Lupron 4 milligram trigger, we'll see what you get, all right? Remember, higher is not necessarily better. BFN at home, do you still have a chance? I always recommend the serum blood test is really important to do, and so don't let go of that. Jacqueline, Luciano, hello. Sydney, hello. Tiki, hello. After laparoscopy, you can do a cycle right after Loking, right after. You don't need to wait. Been primary HGH since January due to delays. No, that's not bad, Kelly. We can get you going right away. By the way, Sharon Gar, hello. Thank you everyone for contributing and sharing ideas, thoughts in this journey. It's not an easy one. Life is a challenge, and we're challenged every day to the relationship in the mirror and the people around us. If we can find a way to dig deep, and the course is really the course of miracles. The fact that you and I are even alive is the miracle of the universe. Thank you, God, for this day, for my life, for the miracle. Thank you for my challenges, my troubles, my problems. Guess what? Dead people have none. We're in the alive category. Let's enjoy them in some way or another, all right? All right, let me see how we're doing. Our energy's getting down, 7. We got maybe about 10 more minutes. I may be finishing a little bit early. I look forward to seeing you guys next Sunday, every Sunday, 10 o'clock a.m. Eastern Time. I got Dr. V doing them, Dr. Magarelli doing them. We got our team. We're working on TikTok, I think, and all these others, but Instagram and Facebook. Thank you, everyone, for sharing the beautiful, amazing energy every single day. Remember, never, ever, ever terminate a process due to low HCG. Pretty Southern girl. Listen, if that HCG is not climbing and we're not seeing an ultrasound by at least 6 to 8 weeks, it may be time to say, okay, let's move on to the next level. Tomorrow, ran out of PIO for today. No, up the vaginal, maybe 1 extra or 2 extras a day will compensate for the progesterone oil. But get a refill. We still think it's helpful, maybe every other day. List for consultation November. I have preconception labs done. Local special AMH is 6. Made it sound like I would never conceive. That's not true. Listen. The naysayers of the world, don't listen to them. Be the sayer of the world, right? The sayer of the world is say it's all true. All things that you believe in the mind. This is where the fertile secret comes. Check out The Secret by Rhonda Byrne. Check out the books on faith and philosophy of positivity. You are the creator of your life, your day, your way. Remember, what anyone else says, you put in your mind to determine whether or not it's the thing that's hurtful, harmful, bad, or whatever, right? You decide. So all you need to do is step in the universe today with love, kindness, and vibrant, vibrant, vibrant energy. All right? Intralipids, embryo glues for everyone now, lipids, Lovenox, Plaquenil, Prograf, Neupogen, intrauterine PRP, HCG washes. If your lining is not so good, then use it earlier. Oral or vaginal Viagra, 25 to 100 milligrams a day. May be helpful in all of this. Acupuncture, massage, meditation, and prayer, right? All right, let me see how we're doing. 6%. We'll see if we can go another 7 minutes. If it ends, next week, plug it in. Remember, we need to be rejuvenated every day. If you're go, and you're not, plugging in the time for rest, digest. This is why I take power naps every day. This is why I go to bed early. This is why every day I do my mindful meditation. Thank you, God, Lord, Creator, for the day. I dream of the seeds of my life in sprouting and blossoming the most amazing fragrance and flowers. Clear the weeds to allow the seeds to grow in your life every day. 15 eggs, 4 mature. The question is IVF in VA. How do you make more mature eggs? That's the $1 million question. If what you did didn't get you, then change it up. You might go earlier. You might go later. You might add some Omnitrope or human growth, some Cerevital. Kiltz's keto, reduce inflammation. Remember, the plant phytochemicals and androgens contain the phytoestrogens, androgens, and progestins that I think do the damage in all of this. So if what you did isn't working, guess what? Do something different in all of this. All right. Let's see. I think we got 5% on my battery. We're going to keep going on the Facebook, Instagram. I love you guys. I'm so grateful to everyone. I'm grateful for my team and all infinitely stepping into the day, working extra, listening and learning. And remember, all of us are here to share kindness, generosity, and a vibrant understanding of all of us are part of the colorful nature of life. And all people of all colors, this is it. We want to be supportive of everyone with love and kindness, listening twice as much as we speak. That's it. Judge with love. Yes, that's the faith maker of your life. How do HCG boosters work? Well, we don't really know this, but I think 250 units of HCG, might be even 200 units once a day. I don't love it right after transfer or IUI. I prefer it with a positive, but if you do use it, you're going to get a positive and you're going to be a little freaked out a little bit, so it takes a little longer. But I don't know how any of this really works. I have my theories and philosophies, but remember, the global approach, the blanket, that's what we're doing here. The global blanket is bringing other things that you say, oh, that doesn't work, or that doesn't work, or that doesn't work. But the truth is, if you keep on saying that doesn't work, there's no data, there's no research. I mean, come on. Faith and belief is faith and belief. This is the perception and creation of the universe within you. I am the thing I believe, and God is who we are, the energy of the God. Oh, 3 Magic Words by U.S. Anderson. If you haven't read it, you must. Amazing. Prime with HCG. I don't typically prime with HCG. HGH, Oralissa, Lupron, Estrase, Prometrium, Keto, LDN, CBD. And remember, get off the treadmill and cool the body down. And the mindfulness of meditation is, thank you, God, for this day. I'm grateful for all that you bring to my day and my way. It's directed thinking. You can't clear the mind of the negativity. You can only focus on the seed that you want it to grow. And it will grow and grow and grow. That which you put your mind to grows. If you're putting your mind to the negative things in your life, guess what never grows? The beauty and wonder and the amazing things. One Wish 4221, hello from Michigan. And we all need to energize and plug into the positivity that God has given us. Yes, troubles happen. This guy got on a cross, right? And he was crucified. He got down, dusted some off, and said, okay, guys, let's talk about the real positiveness of the universe and God's love for and in all of us. So let me say, let's see, 4%. We're doing it. All right. I'd like to get to the 11 o'clock moment, the hour, right? And myomectomy and cyst removal after affect your ovulation. If you took out too much ovarian tissue, it may. I typically like to incise and drain. Endometriomas, cystectomies might take away some of the ovarian tissue, but this is where, remember, fibroids and polyps and endometriosis are all a bowel disorder. Bowel inflammation from a high plant-based fermenting diet. So if you're going to eat the plants, limit them to once a day, cook them well, add the fat. That's where keto lifestyle comes in, which reduces inflammation and makes your body, your mind, your life the very, very, very best. With Endo, I have another procedure to help at the same time as an ERA. You can do a hysteroscopy biopsy with your ERA. You can also add on a laparoscopy, but the timing isn't always perfect. We have to be patient with the process and the ability to integrate all of that. Over 40 in retrieval in August had 4 mature eggs with none fertilized. And, you know, this is, again, the why part of it. It may be telling us bad eggs, bad sperm, bad embryos. This is where IVF is a little bit of a diagnostic procedure. We want to be able to say, oh, we're trying to predict how you're going to do. But remember, you're a human body. The human body is like the mystery machine, right? This is a mystery tour, right? The magical mystery tour of life. And when we approach it with, wow, what a magical mystery tour of life, it's so awesome and amazing every day. And I feel blessed by the creation that we're all doing together. So many people, hey, I'm pregnant, acupuncture, massage, Kiltz's keto, or I simply had my laparoscopy, hysteroscopy, or I did something that you didn't do before, or you kept at it, you kept at it, you kept at it. Never, ever, 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 ever give up, because God is within all of us. We have the power and the vibration of God when we focus on the positive energy that God has given us in life. And remember, troubles and problems are the presents and treasures of the universe each and every day. Curdy, let's see. Oh, Amanda, by the way, and yes, we're going to help, all right? Let's see. Ronia, hello. Megan, a pleasure to everyone. We're just about on let's see, the sun is setting and the day is bright, always in the mind. And I love you guys. I will see you next week, right? And keep asking, keep learning, keep opening. Remember, if you're so fixed in what you believe and you're not willing to open up to the opposites, you can't grow and learn and change. That's really where this is about. To grow, learn, and change through the vibrant energy of an open mind. Always keep that open mind. All right, I'll see you guys next week or this week, whether it's in person with a retrieval, a transfer surgery, or it's a phone call, or I'm going to at least meet and greet you and give you some ideas that maybe you haven't thought about. Our team is amazing. I'm grateful to all of them. So let's keep going with this amazing live journey of life. God bless to everyone, by the way. See you. See you guys.